The coronavirus pandemic is scary. No matter what your station in life, your status, power, or popularity, the coronavirus does not discriminate, and no one is exempt. Vaccinated or not to be vaccinated, mask or no mask, those are the daily questions we are facing. It's time for some real talk about coronavirus facts and myths. Good evening, and welcome to Real Talk with Michelle. My guest this evening is Dr. Emmanuel Mateer. He is the son of two Christian teachers, and he is originally from Haiti. He is married to the love of his life, Bernadette Charles, with whom he has a 3-year-old daughter named Brielle. He is a trained general practitioner from Lumiere University in Haiti. Dr. Mateer moved to the United States in 2009, shortly after completing his studies and a brief work experience. He became a board-certified psychiatric mental health practitioner and recently completed his doctorate in nursing from FIU, Florida International University. He has worked as a resident physician at the Grand Guave State Hospital and here in the United States as a nurse practitioner at South Florida State Hospital, Jackson Memorial Hospital, TGK Main Prison in Miami, Florida, Broward General Hospital, Imperial Point, Wisconsin State Department of Corrections, and Washington State for the past 7 years. Dr. Mateer has a rich cultural background. He speaks English, French, and Creole, with Creole being his first language. He loves his patients and loves that God allows him to minister to his patients while caring for them. Like I said in the introduction, we've been faced with this coronavirus pandemic, and it is scary. Yes. And there are lots of misconceptions, there are lots of untruths, and there are lots of myths going around regarding the coronavirus and the vaccination. And so hopefully the point of this conversation today is just to share and unload some knowledge to our viewers that may have all these misinformation that are also misinformed. Yes. So we're gonna just talk, we're gonna have some real talk. And I'm going to shoot you some questions and, provide us with your medical knowledge. I know that in talking to you, I have learned so much just by talking to you about the coronavirus and just by asking some questions. And so I'm excited to share this information with our viewers.
Wonderful. It's a pleasure for me to be here on the show and share my knowledge as much as I can help the public to understand that pandemic issue that is going around. It is very difficult and challenging at this time. So yes. I'm free for any question that you may have for me.
Well, thank you. All right, so let's dive in. So my first question would be, is the coronavirus and COVID-19 the same thing? folks may not understand where the term COVID-19 came from, and as well as not understanding what is coronavirus. So can you share with us what is coronavirus and COVID-19, and if they're the same thing?
Oh, perfect. That's a nice question. And virus in itself is a submicroscopic infectious agent that is replicating inside of a living cells in an organism. It can be either plants, animals, it could be the human being. So that's for the virus. Viruses have been exist for the longest. The coronavirus, it get that name because of the shape, because it has such a crown shape on the side of the virus. Mm-hmm. So this virus have been identified since 1960.
Since 1960?
60.
Wow.
The coronavirus.
Wow.
So the coronavirus is not new, but the strain that we have right now is new. That strain have been identified in Wuhan, that, as we know from the news, December 2019. So this is a new strain. And because of that, they call it coronavirus 2019. And that's how we have the name COVID-19.
Got it. So the coronavirus has been around for quite some time.
Yeah.
So through different viruses, the names are based on the shape of the virus or the type of virus? How does that work?
Not all the virus get the name this way, but for the coronavirus, based on the history of coronavirus, that's how we get to understand how the name corona, it's a crown shape at the surface of the virus that they call that virus coronavirus.
Wow, that's interesting. Let's talk about the obvious. What are the symptoms of coronavirus, COVID-19? What are some of the symptoms?
Yeah, somebody who catch the virus may, after a few days, or 2 or 3 days, experiencing headaches, nausea, vomiting, can have sore throat, as well as loss of smell, loss of taste, can have shortness of breath, can have body aches, muscle aches. Those symptoms are very common for patients facing the coronavirus.
And it's my understanding that, or I would assume that with everyone, the symptoms are different. We all don't experience the same symptoms.
Oh, yes, definitely, definitely. Some folks would not have any symptoms at all, but some person will just have a little sore throat or difficulty, shortness of breath at some point, which is really interesting to add. So there are certain symptoms when the patient experiences these symptoms, they are emergent. Like if you're short of breath, you're changing color, and you have confusion that is new. If somebody have been confused in the past, so it may not be, but if it's new and you have other symptoms, it's all good to go to emergency.
Okay, okay. So the normal everyday symptoms, loss of taste, loss of smell, stuff like that, but for the dire emergency, shortness of breath, confusion, and if we're feeling that way, that's something that we should make sure we go to the emergency room for. Okay, perfect.
Changing color too.
Changing color.
Yes.
Changing color. So shortness of breath, confusion, and changing color. Those are, okay, so shortness of breath, changing color, and confusion.
Confusion,
If
definitely.
you're suffering with those symptoms, those are emergent symptoms that you need to go to the emergency room
Definitely.
for. Okay, perfect. Another question. I know that when the coronavirus started, there was this big debate about, well, not big debate, because we've been washing our hands forever, or hopefully we've been washing our hands forever. I know some people do and some people don't. So I guess my next question would be, is hand sanitizer because that came into full effect when coronavirus came in. It was around before, but I mean, it became the #1 thing to have on you, have at home, and start using. So is the hand sanitizer as effective as soap and water in killing the coronavirus? What do you recommend?
First of all, I can say that both of them are good.
Okay.
Hand sanitizer cannot take away all the germs that you have in your hands. And based on some researches, so they find out that people who have been using the hand sanitizer a lot do have some pesticide in their body. So which means it's suggested to use it less.
Really?
And also the hand sanitizer need to have a certain amount of alcohol, at least 60% recommended by the CDC. If it's less, it's probably not gonna kill the coronavirus. And the water and the soap, it's cheaper. So you don't pay much for that. You just use the soap and water, and that will kill everything. That will not really kill them, but that wash them away, so you don't have any. So even though you have hand sanitizer, it's required to wash your hand more frequently. And you can use the hand sanitizer as an alternative in between, but that you should not rely just on hand sanitizer.
Okay, so let's talk about the washing of hands, because when coronavirus came, that was another thing that was stressed. Wash your hands and wash it a certain amount of seconds or minutes or whatever. So can you tell us the best way to wash our hands so that way we can kill the germs that may arise?
Wonderful. So first of all, the person has to wet the hand and get all the hand wet, get some soap, and start the hand in itself. Then the person needs to rub the fingers.
Really?
Need to rub the fingers, because that helps you to spend the amount of time that you need to spend. After you finish rubbing all the fingers, you just rub the back of your hand. You make sure that you rub the nails as well, because under the nails you may have some germs as well. So you do that and you count for 20 seconds. Remember, before it used to be 10 seconds, but after that they bring it up to 15 seconds. And now, based on the last research, it has been required that we spend 20 seconds to wash our hands, so all the germs can leave our hands, so we can have our hand free of germs. So that's how we should wash your hands. Then we rinse our hands and we wipe it out. That's how we do it.
20 seconds.
Yes, quite very easy
Right.
and simple.
Right,
Yeah.
right. So as we are washing through the fingers and making sure we wash under the nails, and we're washing away any germs that would be on our hands.
Definitely.
Whereas with the hand sanitizer, because it's always my thoughts sometimes using the hand sanitizer, you're rubbing the germs into the hand, even though it has a certain percentage of alcohol. And then there's sanitizers that are now perfumed. What about those? I mean, as long as they have that percentage of alcohol, is that okay?
That's the percentage of alcohol. That's what will kill the germs. So as far as the perfume, there's no preference in that. As far as the perfume. So the amount of alcohol, that's what is required in order to kill the germs.
Okay. I hope you are learning thus far. We've learned what the coronavirus is, how COVID-19 got its name, and some of the symptoms, especially the emergent symptoms. And we just talked about washing hands and the hand sanitizer. Now, here's another question that I know has been floating out there. If you have already had COVID-19, should you get the vaccine?
That's an interesting question. And when you have the virus, your body reacts to the virus. And that we have now what we call the herd immunity. The herd immunity, that's an immunity that the body creates. The research at the beginning of the pandemic say that it lasts only 3 months. And now lately they said only 6 to 8 months. You don't have a lifetime immunity with the herd immunity. So that's why it's best that someone get vaccinated. And based on the recommendation of the CDC, somebody, even though you had the virus or not, you need to be vaccinated.
Can you get coronavirus from the vaccination, from getting the vaccine?
Perfect. For that question, I would have to say a few words about the type of vaccines.
Absolutely. Please elaborate
There
for us.
are different forms of vaccine. In the US, we have only 3 approved, like they have like emergent approval to use, but not a full approval. The Pfizer, the Moderna, and the Johnson & Johnson. Those 3 vaccines, so the first 2, they use the same technique, which is a messenger RNA vaccine. So that technique have been in place since 1990s. And compared to the Johnson & Johnson, which is a viral vector vaccine, the viral vector vaccine, this one used the vaccine, but it's not a live vaccine. So they change the DNA of the virus so that the replication, when the person gets the vaccine, it does not replicate. And that's what happened when we get the virus. The virus multiply into our body. So now we will have it in our nose. So when we sneeze, so we spread it around, and people can smell it and breathe that in our lungs, and we get sick. So the virus works this way to get someone to have immunity. So when you take the vaccine, either the mRNA vaccine or the viral vector vaccine, which is the Johnson & Johnson, so those, they cannot change to make someone having difficulty, either hereditary to having problem giving birth, because some people have concern that will affect their fertility. It does not affect people's fertility because it degrades into our body after the body builds the antibodies. So it degrades really fast, so that will not work, that will not advance to our DNA in order to attack our reproduction or our fertility system. If I can add that, you cannot get the virus from the vaccine. So either from the mRNA vaccine or the Johnson & Johnson, which is the virus in itself, they inject you, they change the DNA so the virus will not replicate, will not change into our body, so we can't get sick from the virus.
And what are some of the side effects of the vaccine?
The side effects, we need to look at it like the site and the physical. So when you first get it at the site of the injection, you will feel some pain, redness, maybe swelling. But after, between 1 day, it's 2 days, you may have some fever, headache, or maybe some discomfort like malaise. So that's what may happen when someone gets the vaccine in itself.
So do we know whether or not there are any long-term effects from the vaccine?
So far, the long-term, they are working on that.
Okay.
Adding to that, I want to say that is one of the reasons that they don't have a full approval for the vaccine. Usually, vaccine takes time before they come on the market. But because of the urgency and this company, they work fast as getting participants to the trials, and they were able to put these vaccines on the market. But they did not. They had enough participants to say the vaccine is safe, but they cannot say about the long term because it has been there for a short amount of time, less than 2 years. It's about to have 2 years now. So normally, when they are doing making a vaccine, so you have to use the efficacy and safety. So as far as the efficacy, it has been proven based on the research. But the safety-wise, we still wait to see. Based on the research that have been done, they are very confident that it will not, but they're not sure yet. So I can add that for the Pfizer, for example, they had 43,000 participants. 43,000.
That's a lot.
Yes, a lot. So when they look the sample of patients who catch the virus, they look back and among the participants in the trial, they find that 8 of them had the vaccine, and 162 of them did not have the virus, the vaccine. So that's why they say the vaccine is 95% effective for this population. And they did that trial as well on patient who has developed severe form of the virus. So this patient, they find that 9 of them did not get the vaccine. Only 1 had the vaccine. So they believe by having the vaccine, you are 90 to 95% safe from not getting the virus and from not developing severe form of the virus.
Wow.
So when we look at the Moderna, for example, the Moderna, they did a trial on 30,000 patients, 30,000 from 18 years old and above. So they find that 11 out of 185 clients, 11 did get the vaccine. 185 did not get the vaccine. So which means because of that discrepancy, they clearly prove it from the research that the vaccine is safe.
Wow. Wow.
So if someone gets the vaccine, they should be protected based on the research that has been made.
When are people with coronavirus most contagious?
That's interesting. Because 1 or 2 days before the symptoms occurred, that calls prodrome phase, patients are very contagious. Very contagious 1 or 2 days before the symptoms start. And that will last up to 10 days after. So which means about 12 days. But we should count from the time the patients start developing symptoms. So from that, we will say 10 days. That's why you see the quarantine, they lower it down from 14 to 10 days now. But we could say the time that the person is most contagious is 1 or 2 days before you start having symptoms. But you still are very contagious after the symptoms start. So that's why you have to stay in quarantine. Because every time you sneeze or you talk in public without a mask, you are exposing others because you spread it. You spread the virus in the air. I can add that too. So when you cough or you sneeze, the virus stay in the air for up to 3 hours.
Wow.
Yeah, up to 3 hours. So that's why you can be in that place, you sneeze, you go away, but somebody else come around and still be able to
inhale that.
Exactly, to inhale the virus, and that person will be sick. So that's why it's good to keep your mask on.
So let's talk a little bit about, we've heard a lot about people having underlying factors when it comes to COVID-19. So what underlying conditions put people at higher risk regarding the outcome of COVID-19? What are some of the underlying conditions?
So far, what we have seen from the result, a patient who had a heart condition lung condition, who had diabetes, obesity, or a sickle cell, these patients or cancer, they seem to have more risk to have a bad outcome from the virus than healthy people. But does not mean, as we see from the statistic as well, we see that healthy people have been affected by that, and there's casualties among healthy persons as well. But we know that the risk is more when you have underlying conditions, as such what I just said earlier.
Okay. Is it true that kids can't get sick from COVID-19 or that they can't spread the coronavirus? That's also another myth that's flying around out there. So clarify that for us.
Allow me to be straight.
Absolutely.
No.
They can't get
Yes, they can get the virus and they can spread it as well. So, but the research have shown that when the kids had it, the first strain of the virus, they did not present as more symptoms as lately. Most of them, they were asymptomatic, or the one that present some symptoms were very mild, either a little fever or a little malaise or cough, and they're good, but not really severe symptoms. So we should not base on that to say that they cannot get the virus. They can't. And they can once you have it, you can transmit it.
Right.
So,
child or not.
Exactly.
Child or not.
And what the last data we have on that, around the world, up to September 2nd, we have 5 million children who have been affected by the virus so far.
Wow.
And just the last week of August, in the US, they had 252,000 children being affected by that. So which means it's serious for child as well to be affected by the virus, and they can transmit it as well to others.
But I think what was happening is when the coronavirus started, it was mainly, we were hearing mainly about adult cases and not so many children. So I think it was thought that the kids, weren't getting it or couldn't get it because we were hearing more about adult cases at that time.
Yeah. So as everybody knows, this is new. We all are learning, and at the beginning they see that more very elderly are affected and die from the virus. So that's why this information came out. But as we get further deep into it, we realize that even kids still affected by the virus. Yeah. So it's important to stay safe, to help the kids to use all the measures as well as the parents to stay safe.
Great. I must say I appreciate the simplicity that you're giving the explanation so that us everyday people can understand. So in doing so, explain to us what is the Delta variant, because this is another variant that showed up and everyone's nervous about it. So tell us what that is. All
right, perfect. So the Delta variant, first of all, let's say the virus, remember I said that they are an infectious agent. They get into a cell, a living cells, they replicate, which is they multiply. And they keep multiplying. As they are multiplying, they change form. So that's why they talk about the strain, a different strain or different form, because in their DNA, they are changing forms in order to stay alive, because they want to stay alive. And they are smart. They are smart.
They have characters, it sounds like.
Exactly. They try to stay alive, and they are changing forms. So far, they have identified many, alpha, delta, gamma, mu, and delta, delta as well. Delta is the last one they identify. And with the delta, in the US, 72% of the hospitalization are related to the Delta variant. And that's why they understand the Delta is predominant. So we have more cases. So the Delta beats the Alpha that was predominant in the US right now. So, and we see there's more fatalities as far as loss in life. Around June, the amount of death a day get lower than 200. And guess what? Recently, around September 2nd, the amount of death a day was about 2,000 a day.
Increased.
Some days are very close. So, but it's really bad as far as the Delta variant. But I want to add that too. The vaccine is effective for the Delta variant.
Okay.
Based on the research, according to the CDC, they said the Delta variant is covered by the vaccine. Because once you get the vaccine, you're not gonna develop the advanced form of the virus, of the severe symptoms from the virus. Even though you may catch it, you may catch. This is a breakthrough. It's not everyone. They find that a few. Like, remember we said that 95%, which means there's a certain amount of the patient that probably can get the virus. But they talk about breakthrough. The breakthrough may happen. That's why we still need to use some measure as far as washing our hands, put our mask, because we don't want to be in that little 5% or 5 to 8% that can catch the virus.
Let's talk, you mentioned the mask wearing. What are some of the best masks? Because when coronavirus came up, people were, there's the N95, there's a surgical mask, people are wearing bandanas, people are wearing the face shield, people are wearing, so give us some information regarding the type of mask, how do we wear them, and how effective they are.
The mask need to be worn. When you wear the mask, there's a certain way that you need to wear the mask in order to make it effective.
So I brought some masks.
Perfect.
I brought a
That's
few.
good. That's good.
So let's go
use
through
that.
them and just demonstrate to us.
I will demonstrate. Thank you. So you need to wear the mask a certain way in order to make it effective, and also the type of mask as well. This surgical mask has 3 layers in it, so which means it's protected. But when someone wears that surgical mask, it has an aluminum nose bridge. So when you have a mask that does not have the aluminum nose bridge, it's about 44% efficient. But when you have that nose bridge, it brings it up to 60%.
Okay.
And depending on how you wear that loop behind your ears, will make it more effective. Like for some folks, they will just turn this and make it more tighter so there's no more air getting in. So that brings it even higher to 70% more than that, okay? So it's best that we wear the mask the proper way. And I would say for the folks who wear the mask and they cover just their mouth, they don't do nothing. It's better they don't wear it.
Right. I
Because
see a lot of that, yes.
You're breathing. So if you are breathing, that's how you can get the virus. Why not covering your nose? That's what is important to do. You need to cover your nose so that you don't inhale the virus.
Okay.
So the surgical mask is very effective, but it's not the most effective.
Okay.
But before I talk about the most effective one, since you came with
A few.
I would say that
I came with a few based on what I see people wearing. And how.
Good. That's good. The bandana is less effective than the surgical mask.
Okay.
The bandana.
Okay. And we see that a lot.
Yes. Because the bandana, not all of them are in cotton or nylon or linen. So not all of them are the same texture. And some of them are very thin, some of them are thick. So it depends on the texture of the bandana.
So the texture matters more than style. Texture with the bandana.
Yes. Because the thinner it is, the more the virus can get through, because it's a very submicroscopic infectious agent, as the virus is. So a virus is really, really small. So if you're breathing, you can feel the air pass through, so you can get it. So it's much less effective. So we find that some of the bandana that is around 30-something% of protection, efficiency. But depending on the texture, it could be around 50 as well. But most of them are around 50.
Okay.
So these kind of masks are very, I would not say they best than the surgical, because they don't have that
The
nose bridge.
Okay.
So they are less effective anyway than the surgical mask. But the one that is more effective is the N95. The N95, if you are caring for a patient at home that has the COVID and you don't want to get it, I would suggest that you wear your N95, because it has like a 98% effectiveness rate. So which means it's way more effective than any other mask. That's why it's recommended, and you would see most of the people in the hospital, depending on if they are working with patients with COVID, they will wear this.
And what's the proper way to wear the N95 mask?
The N95
because I see it in different ways on people's faces.
Okay. The proper way, you said this one has not been used.
No, it's not. It's clean. It's new.
Perfect.
No, doctor, I would not do that.
I know you will that. Perfect. You would not do that, so my bad. So the first thing you do is you put down first the top one, and you hold the bottom one, and you carry the other piece below your ears. The first one needs to go on top of your ears, like higher than your ears, and the second one was supposed to go below. And as you're wearing this, you make sure that you get your the nose bridge fit. So you fix it. So after you fix it, you make sure that you don't feel like any air is coming because it might be in a different angle and cause air to pass through much easier. So you make sure that it's well fit. So once it's well fit, you're good. And in those masks as well, let me unfold and take it off. So I can speak, people can hear me. So in those masks, they have size as well. So that's why you can see some size doesn't fit small people or a big person. They would have a really small one. So you can look out for the size as well if it fits you, because you need to have some mask that fit you in order to make it effective. So even the surgical mask, now I see that they do for kids. So the one for kids, they don't keep an adult safe because they go just around the mouth. They don't go deep enough to protect you. So you need to look for that as well.
Okay, interesting. Because I do see all types of fashion masks and all that stuff. So we just wanted some clarification as to how to wear them correctly, and what's the best recommendation. So thank you.
It's a business now, so
Yes,
they're trying to make business without paying attention to the health aspects or to the safety aspects. But the surgical mask and the N95 have been, the studies have been done, and that's why they do them, to protect persons. So it's best.
Okay, so here's my next question. If I'm wearing a mask and I need to sneeze, what do I do? What's the best way for me to sneeze while wearing a mask?
This is hard for me to say. So if you sneeze, there's a lot of germs that come out. But they are your germs. If you're okay with that, you can still carry the mask and carry on until you get somewhere, you discard it somewhere that is safe. Because after you sneeze, after you use a mask anyway, you cannot put it somewhere and people will touch it. That's a risk as well. So the best scenario would be you use a tissue. Even when we don't have a mask, we would need to sneeze. We use a tissue to sneeze. So if we don't have the tissue to sneeze, so we use our elbow like that. We do it in our elbow. But some folks will do it in their hands. I would say, don't do it. Don't do it, because you are carrying those germs for someone else, because you're going to touch a door, you're going to touch different things that other people will touch that will contaminate others. So you don't do that to others, like you expose other persons. So try to be more responsible as far as you sneeze in your elbow or you use a tissue. Like I said, if you have a tissue, you have your mask on, you just get your tissue and sneeze in the tissue and you put your mask back. And that's the best way we can do it.
Okay, all right, interesting. Is it safe for us to go on vacation? We have the vaccine. People are feeling okay because I take the vaccine now, and even though I'm still wearing my mask, it's okay now for me to relax a little bit and travel. Would you recommend that it's safe to go on vacation?
So far, experts still do not agree that someone goes on vacation at this time, still. Because they believe that in order for us to be safer, at least 70% of the population need to be vaccinated. And a tremendous effort have been done so far. We are at only 54%.
Okay.
About 178 million persons have been vaccinated, fully vaccinated in the U.S. But there are still a lot that are not. So which means the risks are still there, the risk to get contaminated. So if you go on vacation, for example, you're going to travel, just being in the TSA, in the line, it's really hard to respect the 6 feet. And like I said earlier, it's really hard to keep the mask on without even take it off for a minute, to respect that in their plane as well. As you sit next to someone, and it's not for 5 seconds, it's for hours. So as you are in the airport, you are going to bathroom, you are using other instrument, you are at risk at touching, at getting yourself exposed and infected. So that's why it's not recommended. As much as we can limit our movement, the best it is. So in that context, I would say it's not advised up to this point. But I understand at this point, everybody is living the life. So if someone is able to use all the measures, I would not say go, but what the experts say, it's not recommended.
Right, right. You mentioned the 6 feet, maintaining that 6 feet. Tell me a little bit about how it was determined that we needed to stay apart for 6 feet, and how does that help us effectively during this coronavirus?
Perfect. That brings me back to something that I should have said at the beginning, as far as the virus. Yeah, the virus in itself, they say it's a droplet, droplet virus, a droplet infection from that virus. So that's different. So we can have droplet, we can have airborne. The airborne, it remain in the air. The virus remain in the air for at least 6 hours, for about 6 hours. So it's much easier for the airborne virus or bacteria to travel distance because they are more lighter. They are lighter. But for the coronavirus, it's between the droplet and the airborne because it remains in the air for 3 hours. For the droplet, they don't remain in the air for as long the coronavirus remain in the air. And on top of that, they find out that some affected person have been affected at a distance much longer than 6 feet. So because it's categorized as a droplet virus infection, so that's why they determine you need a 6 feet to remain distant from the other person, not to get contaminated if the person is sneezing or breathing the virus, so you don't catch it. So that's how they determine it.
Okay.
But you still need to wear your mask even though you have the 6 feet, and you still need to wash your hands.
You've advised us to still wear our mask, especially with this debate that's going on these days with the schools about wearing or not wearing the mask. So if the kids today, if they don't want to wear a mask, as a parent, if your child does not want to wear a mask, what would you suggest that they do?
When you give someone option, that empower them. That empower them. So as a child, you cannot just force the child not to do it. If you do that, you may find resistance and you never get to where you want to be. Like get them comply and be able to use it because it's a safety issue. So you try to explain the child about what is going on and help them to see good information as well. As you explain the risk that is behind not using the mask, at least you can help them. But if still you don't get that what you want, you give them option, alternative. So that's what I would say. I would do it.
But
if
not
you do
just for
it,
kids. Not just for kids.
no. What I would do,
Yeah.
what I would say for the kids. So if you use the mask, we're going out. If you use the mask, okay, we will probably continue going out. But if you don't use the mask, so you would have some punishment. Just to give them alternative about using the mask or not using the mask. But they can use it as they may not. But if they don't use it, here is what the consequence may be. So as you give them the choice, of course they will choose it if they want to go out, if they want to hang
Have
out.
some normalcy in their life.
Exactly. So they will. They will.
But I think that also goes for the adults too. It's not just the kids that are choosing not to wear their mask. A lot of adults are still.
But I believe a lot of folks, they don't use the mask because of bad information that they receive. There are a lot of information going on around. And if you get your information from the social media, of course you will not use the mask. But if you get it from a well-respected and credible source, you will definitely see that this is important to wear.
And that's what we're hoping for this evening. So as we prepare to wrap up, I guess my question to you would be, what advice would you give for me to tell friends, family, or coworkers who are hesitant? We went through the reasons why the vaccine helps, but we still have a lot of hesitancy from a lot of people, whether it's family, friends, coworkers, or neighbors. Or what would you tell them about being vaccinated? I know that we covered it a little bit, but let's go back to what should we tell folks about getting vaccinated?
For that question, it's about teaching. But before I get to that part, I would tell my friend, let's go get vaccinated. I'll just go, let's go get vaccinated.
I don't know if it'll
Because
be
some
that
of
easy.
them, some of them, they just need someone to just push them a little bit. But it's not going to be easy, as you said, because based on the statistic as well, they find out that the amount of people saying that the quantity that say they will never take the vaccine has not changed since the beginning, since May 2020. It remained around 16%. Now it's about 15%, but it remained the same, no change. They get that in their mind, they will not take the vaccine. Because some folks had issue with the efficacy or the safety of the vaccine. But as a lot of people are getting the vaccine and they don't see as much casualties from the vaccine, So they said, oh, why not taking it? Because it saved lives. I would say that the information need to get out. Help these folks understand. And with truthful or with information that is really fact, proven by the scientific, well-proven source, you give them this information and ask them to go to those credible sources as well to get information for themselves. Like tonight, I would like to advise the people who are watching. They need to go on the website for the Pfizer, for the Moderna, to look in the ingredient of the vaccine to see what is in there. Because there are a lot of misconceptions, misinformation about what is in the vaccine. So there's none of what they are saying that is included in the vaccine. So the best answer is teach them. Teach them the good information and help them to understand. And that's how we can help them to be less hesitant. As I can say, to conclude the answer, so we have seen the gap close down because better information is sharing around and people are seeing what is going on. And as their family, the close one, are getting affected compared to the one who have been vaccinated, so they realize that they should not play with their life. They need to take the vaccine.
Before we close, let me also ask you, because I know that this is an area that is very familiar to you, how has COVID affected the mental health community? People with mental health issues, as well as the caregivers. How has coronavirus affected them?
Yes, that's my field.
Yes.
So the COVID-19 has been a traumatic situation with the shutdown, with the condition that people have to leave, not to go into work. It affected people in different aspects in their lives. And that leaves some impact on a lot of persons. At the beginning, we find out that some folks have been doing well in terms of anxiety because some patients have anxiety being in crowd. So when they stay at home to work, their anxiety go down, so they feel good. But we did not see the cases of anxiety related to the COVID that will come out months after. Lately, we are seeing a surge of anxiety, depression, PTSD, paranoia, because some folks are really paranoid. They don't like touching anything. They fear of the vaccine in itself. It affects people mentally because it's a traumatic incident. So we are starting to see that as of now, and eventually that will continue to occur along the way with people presenting symptoms of anxiety related or depression, delusion, as well as PTSD that could be related with the trauma related to the COVID.
But have you found that it's more stressful for the healthcare workers or the nurses or the doctors in the mental health field? Do you find that it's more stressful now to deal with their patients because of COVID-19?
As far as dealing with the patient, it's pretty much the same thing, but it's just the amount of work, the overwhelming need for healthcare worker, and the amount that have they are not sufficient enough to cover in all the throughout the country. So it's a challenge. They are adapting themselves with the situation. It is hard. As you know, a lot of healthcare workers die, so that creates a gap as well. So we have much more need in terms of healthcare worker. So it affects both, either the patient and the staff as well. But the staff is more about the overwhelmed. They are overwhelmed. In the field, we find more patients in need of care that we have to deal with.
And I can't imagine the amount of stress that brings on.
Oh, yeah, definitely. Yeah. Definitely.
So as we're about to close, I would like for you to please look into your camera, and just give some words of advice, recommendations. I know that we have gone through it through the questions, but just give a summary and some advice and encouragement to our viewers out there. You know, we have tried to address some myths, and we unloaded facts. You know, there are things out there where people are saying, you know, the vaccine, you grow another head and an extra toe and, you know, different things. So I would like for you as the professional, medical professional, to please just give us some words of advice and some recommendations so that we can stay safe and as we navigate our way through this pandemic. Just look into your camera. And do
Wonderful. I just want to say to my viewers that the virus is real. The virus is real at contaminating people and bring people to hospital and create a gap in families, to change the dynamic of the families. It's best that you use all the measures. I'm not telling you to go ahead and take the vaccine as I'm closing, but I'm just telling you take the decision that is good for you. But if you're not taking it, take all the measures recommended by the healthcare expert so that you protect everyone around you and you protect yourself, and every one of us will remain healthy. Thank you for watching.
Oh, thank you so much. Dr. Mateo, thank you so much for being here on Real Talk with Michelle. Thank you for the simplicity of the explanations, because you could have gone on some medical tangents that we would not have understood. But thank you so much for explaining it in a manner that we can appreciate it and better understand as we go through this pandemic. So I really, really appreciate your time. I appreciate your knowledge. And I pray that God will continue to use you as you continue to minister to your patients and keep you safe as well throughout this pandemic.
Thank you very much, Michelle. And it was a pleasure for me to be here to share what I have as information. And I really hope that does not create more confusion to them. But I want them to go to the good sources.
Absolutely.
And confirm what I just said and confirm information for them as well so that we all remain safe.
Absolutely, absolutely. And I highly doubt you caused any confusion. If anything, you cleared up some confusion.
Perfect.
Some confusion. And to your viewers, thank you so much for watching. Thank you for your continued support. If you'd like to reach us here at Real Talk with Michelle, feel free to email us at realtalkwithmichelle1@gmail.com. Thank you for watching, and until next time, let's have some real talk.